With great pleasure, I join you today from Rome in this prestigious 7th Global Forum with the theme of Global Common Good after the pandemic, the partnership in action on net zero, digitalization, and generations. My appreciation to the organizers of this forum and thank you for having me today. My presentation is entitled The Chameleon Disaster Service International or CADIS Interfaith Partnerships Across Borders, a new lesson of global solidarity and an affirmation of the common good. It will deal with the chameleon experiences and lessons learned in delivering healthcare services, particularly amid the COVID-19 pandemic. This presentation is divided into three parts. First, major problems and solutions, lessons learned the second, and last, new challenges and opportunities. The Chameleons, officially known as the Order of the Ministers of the Infirm, is a Catholic religious congregation founded by Saint Camillus de Lelis of Italy in 1586. The congregation serves in 37 countries, delivering healthcare services to the poor for more than 400 years. It operates over 200 healthcare facilities, particularly in low-resource regions. The commitment of the Chameleons extends beyond the perimeters of our healthcare facilities. We reach out to the most vulnerable communities affected by disaster through our humanitarian foundation called the Chameleon Disaster Service International or CADIS in 2016. Since then, the Chameleons have reached out to almost 300,000 individuals, delivering humanitarian relief and strengthening the resilience of disaster-affected prone communities. So what are the major problems we solve? The COVID-19 pandemic has caught us almost unarmed and unprepared to sustain our healthcare programs and services. Many of our healthcare personnel and the institutions were physically, psychologically, spiritually exhausted. Humanitarian relief and resilience projects were put on hold. Over 100 chaplaincy ministries were temporarily suspended. Personnel and their families were psychologically and economically affected, and some members of our congregations were infected or died of COVID-19. The COVID-19 pandemic has put all of us, particularly the poor, at risk. When total lockdown was declared, absences of personnel were noted. Unfortunately, some states and low-resource countries where we work could not provide public transport for critical care personnel. It caused delays to critical services in our health system. There has been difficulty in scheduling hospital shifts because of the volatile sociopolitical situation. Moreover, the lack of personal protective equipment aggravated the situation, which resulted in coronavirus infection to some of our personnel and the consequent lockdown of our healthcare facilities. This put at risk to many sick persons in need of our services. The chaplaincy ministry, which usually provides for the patient's psychospiritual need, was suspended or allowed under strict conditions. This has significantly impacted the patient's well-being. Patients were left alone on their hospital beds without the visit of the members of their families. There was a significant gap and difficulty with appropriate communication between the patient, the care team, and family members. Patients who died of COVID-19 were deprived of the last Christian rites, sacrament of reconciliation and anointing, and funeral, and some of the family members harbored guilt feelings for not being there before and during their death. Frontline medical personnel were psychologically tormented. They were profoundly bothered with guilt feelings for not being able to perform well and save their patients. They also felt guilty for bringing home the coronavirus to their families. Many performed like real heroes at the expense of their personal well-being. Many of our healthcare institutions are receiving minimal support from the states and in some cases none at all, yet continue to offer better quality services. With the lockdown measure and panic, we lost a significant number of clients. It has negatively influenced economic sustainability of some of our hospitals, particularly those in the peripheries. The absence of government subsidies and locally generated support resulting from the historical depletion of economic support from Europe, our mother region, has placed at risk our healthcare facilities. Monitoring the COVID-19 infection progression through the COVID-19 digital maps like the one of Johns Hopkins University has helped us understand the growth of the infection globally. However, to get a realistic view of particular situation where we operate in more than 30 countries, we organized a twice-a-month Zoom conference with the leaders of our provinces and delegations beginning in June 2020 and quarterly in 2021. Regular situational and needs assessment reports were presented by each of the 17 leaders, and the central government collated all information and mobilized support. Logistics is one of the most prominent barriers to delivering healthcare services, particularly in coordinating and moving human resources from one point to the desired destination. To resolve the mobility issue, a staff dormitory and isolation rooms were provided within the premises of our healthcare facilities for the frontline staff to minimize travel. As a result, very few personnel have been infected with COVID. The lack of supply of personal protective equipment or PPEs has been felt particularly in Asia and Europe. To address the gap, the Chameleon Mission in Taiwan has mobilized an aggressive fundraising campaign Help Italy, the epicenter of COVID-19 infection in Europe. The campaign made a tremendous success and the result went beyond their target. PPEs reached quickly in Italy and Spain through our central government in Rome and some diplomatic channels, which facilitated the reception and distribution of supplies import tax-free. Supplies have also reached our missions in the Philippines, Indonesia, Thailand, and India and elsewhere. The timely delivery of supplies was due to the partnerships with private, such as Tutsi Foundation, and public agencies and institutions. Our partnership with Tutsi in India was a landmark initiative that brought tremendous relief to the most vulnerable communities impacted by the pandemic. Chameleons are known for their holistic approach to the services offered to sick persons. Apart from the medical services, we offer psycho-spiritual services to our chaplains in the hospitals. However, not all chaplains were able to exercise their ministry due to the restrictions imposed by the hospitals. To fill the gap, chaplains organized webinars on psychosocial spiritual assistance and online counseling to COVID-19 patients and their families. This overcame the epidemic of disinformation, myths, and cultural beliefs. Above all, it offered hope to patients with COVID and their families. Another important dimension in our response to the COVID-19 pandemic is the care for healthcare workers. COVID-19 has placed extreme demands on healthcare workers. They face genuine threats to their physical safety and indirectly to their families. They experience stigma as a result of working during the pandemic, which extended to their families, with some reporting their children being discriminated against. Mostly, healthcare workers are psychologically resilient professionals trained and experienced in dealing with illness and death. However, the mental health and psychological well being of this group were already being identified as a significant healthcare issue, evidenced by the growing incidence of stress, burnout, and depression. One of the most significant sources of tension was the competing obligation of healthcare workers felt between providing exemplary care, patient care, and protecting their physical safety. Strict infection control procedures meant that staff could not always intervene in the way they wanted, resulting in them feeling like they fell short of their usual standards of care. Concurrent with the pressures noted above, many healthcare workers describe aspects of the work as enjoyable and rewarding and appeared to derive job satisfaction from work that they felt was important and meaningful. Stress management support, prayers, worship, liturgical celebrations, and monetary incentives were found to deliver the needed support and encouragement. Workshops on coping and emotional support and the availability of helplines were organized. Beyond the premises of our healthcare facilities, a vast number of the populace were equally affected by the pandemic. Many of them live with subsistent earning. We mobilized relief support for these families. In India, they organized and mobilized different religious congregations in various states to deliver relief goods to these families. The key to the success of the initiative was partnership in the context of collaborative ministry. This happens when individuals pool their abilities and make decisions in common, trusting others to deliver the target activity in their way, reporting back not decisions for approval, but results. Therefore, the chameleons have transformed the distressful situation into positive engagement using available resources and capabilities. The partnership is one of the critical strategies applied. As Pope Francis emphasized, the notion of interconnectedness of everything in our common home has been the source of inspiration that lead us to find better solutions. The global pandemic has enriched our solidarity and commitment to work together as one family to reach out the most vulnerable in our society and link with our hands with other faiths. Regardless of the severity of the crisis, a proactive and open engagement to overcome the COVID-19 pandemic unveils the truth that there are enough means to tackle the crisis if we pool our capabilities and resources together. So, what are the lessons learned? Reflecting on our experiences of confronting a global crisis such as the COVID-19, faith-based organizations like us are uniquely positioned to work on social mobilization and community engagement because they are at the grassroots. Ensuring behavior change is challenging, but the trust and authority invested in faith leaders mean they be better placed than others to communicate the necessary changes to customs and practices. Faith-based organizations have also formed the bedrock of the pandemic crisis response to COVID-19 in many resource-constrained settings globally, promoting and safeguarding the mental, physical, psychosocial, and spiritual well-being of millions of people around the world. Religious leaders, faith-based organizations, and faith communities played a significant role in saving lives and reducing illnesses related to COVID-19. They are a primary source of support, comfort, guidance, and direct health care and social service for the communities they serve. They provide pastoral and spiritual support during public health emergencies and other health challenges and advocate for vulnerable populations' needs. Faith-based organizations champion attention to and inclusion of vulnerable populations, including minorities, migrants, refugees, internally displaced persons, indigenous people, people with disabilities, and members of other marginalized groups by creating supportive environments, advocating for the rights and access to diagnosis and treatment and vaccines, and sharing evidence-based, accurate information. So some challenges and opportunities. Funding and partnership. First, youth funding gaps continue to hamper the execution of our program goals and objectives of restoring health into the hands of the people. The pandemic offers an opportunity for private sector entities in particular to plug resource gaps by increasing funding and partnership with faith-based organizations and vice versa. FBOs can deliver results efficiently and effectively because they are bound by the imperative of their charism to unconditional service and not just by mere contract. Second, vaccine access inequity. COVID-19 has laid bare the colossal disparities between the hubs and the have-nots of the world. While many high-income countries were close to vaccinating half of their vaccine-eligible adult populations by the middle of 2021, most economically disadvantaged countries had not vaccinated even 20% of their population within that same timeline. The sheer scale and speed of vaccinations required to achieve herd immunity in low-resource settings mean that these countries cannot rely only on existing or sometimes even non-existent national or international development infrastructure and mechanism. There is an urgent need, an opportunity to leverage the integrated network of volunteers, health personnel, and infrastructural assets of the faith-based organizations across low-resource regions to expedite vaccine access and delivery in hard-to-reach areas and underserved communities in developing countries. In conclusion, every crisis is seen as an opportunity. We do not blame darkness. Instead, we light a candle and prove that every long night ends at dawn. Challenges abound, but grace abounds all the more. We are playing the role of Good Samaritan to the affected brothers and sisters in this nation. Be messengers of God's universal love. All of us are brothers and sisters, and as long as we are part of God's universal love and sharing it, we are called to universal fraternity. A new post-COVID world is waiting to be born. As Dharma Master Chen Ying said, unquote, we must learn from these grand lessons shown to us these unchallenging times and benefit all beings. May we do good and bring harmony to the world, unquote. We are left with the sadness of not being able to do more, and at the same time, the hope that these small gestures will be an example that will motivate other people to join this cause. Let us stand together to fight this pandemic. Let us put more hearts into our hands. Let us spread the virus of solidarity, the firm and persevering determination to commit oneself to the common good and the good of all and each individual because we are really responsible for all. Thank you very much. and have a nice day to all.